Hi guys, welcome to Cook to Nourish and thank you for tuning in. I have been out for a few weeks and so had not been doing videos, but I'm back in action and will be bringing you more content both relative to cooking as well as nutrition. So today I'm starting a new series on nutrition and in this first video, I will be talking about the causes of inflammation and autoimmune disease. So this is a series where I'm focusing on all autoimmune diseases, in terms of causes as well as what can be done to manage autoimmune disease. So in this first episode, I will talk about what are the causes of inflammation, why the immune system gets imbalanced, and that's like the foundation. And then in the next series, in the next episodes, I will talk about more about specific diet, especially the AIP diet, etc. All right, so let's get started. So what causes inflammation and autoimmune disease? Now, inflammation is part of body's inherent immune response. So whenever you hear the word inflammation, we think that it's a bad thing, but it's not necessarily a bad thing. So most of the times, or I guess in general, inflammation, when it happens in the body, it's body's defense mechanism to fight against something that is harmful to the body. For example, virus, bacteria, or parasites, etc. And what body does is the immune system, when it fights against these these foreign invaders, then that fight actually results in some reactions that are happening inside the body, and those are things like pain, there is redness, there is swelling, there's immobility, and that's all related to the action of the immune cells fighting, against those pathogenic, organisms, whether it's bacteria, virus, or parasites, etc. And then that actually, it could even be toxins, and then that inflammation starts to appear quickly, and then it goes away fast because as the immune system is able to overcome that whatever was attacking the body, as the immune system was able to control that, then the inflammation goes away. So essentially, inflammation that is good for the body is always acute. It happens for a short amount of time. For example, when you get a viral fever, you are out for a couple days, right? And as the body's immune system is trying to attack that virus, and then after the second or third day, you begin to feel better. So that's those are essentially the signs of inflammation: pain, redness, swelling, immobility, heat, even fever, right? But chronic inflammation is something that keeps happening, like the same kind of symptoms that I told you. If those symptoms, the pain, redness, inflammation, if those things keep happening over and over, day and day, again and again, and it continues to last for months and even years in many cases, then that means that there is something wrong. That means the immune system is either not capable of controlling that cause, or the immune system itself has gone imbalanced, that it's not able to function properly. And that's when you have chronic inflammation. Now, what are the triggers when you say that, when I say that immune system gets imbalanced? What is essentially happening is that there are lots of different things that can attack our body. And when those things happen, the immune system is always on guard. For example, infections, which I already talked about. Then sometimes there are also genetic mutations that can happen. Essentially, and I'll not go into the details here, but the MTHFR and the HLA gene mutations that can cause in turn, a leaky gut situation where the intestinal permeability is increased, and there are, that can trigger a lot of immunogenic responses in the body, and that can cause, play a role in immune imbalance. Then there are toxin exposures like pesticides, heavy metals. If you are getting exposed, if your body is getting exposed to these things, then also the immune system gets triggered. Gut dysbiosis. Now I'll touch upon these three things together. The gut dysbiosis, that means the imbalance in the good and the bad bacteria in the gut. That is dysbiosis. So when that is there, when there is nutrient deficiencies, when there is an inflammatory diet, that means you're not eating the right foods, you're eating foods that are inflammatory for the body. All these things can have an impact on overall gut health, and gut health has an impact on the immune system. And I'll show you that because it causes a leaky gut situation, which I'll explain to you on the next slide. And then there are other lifestyle factors like stress, lack of sleep, sedentary lifestyle, or even overactivity of exercise. Both are equally bad, And then certain drugs, it could be medications like, you're taking in prescription medications like antibiotics, NSAIDs that are non-steroidal anti-inflammatory, corticosteroids, as well as it could be, other harmful recreational drugs that you may be using, or over-the-counter drugs that you may be using, which ultimately also erode the gut lining and cause that immune system to trigger. So these are triggers for the immune system. And then ultimately, what happens with all these things happening, what all the different factors that I talked about, with all those things happening, the number one thing that causes the immune system to not work properly is overload. So the best way I like to, explain this is, for example, there is a fort that, say the army of soldiers, an army of soldiers is defending a fort from invasion from, outside, right, from the enemies. Now, if they are working, if there are 20 people there, a soldier of 20 people, an army of 20 soldiers, and they have shifts, right? So they work in shifts and they guard the fort against all possible threats. Now, they're working properly as long as the threats are a reasonable amount of threats. But say, for example, the threats increase a lot. That means, there are lots of different enemies that are attacking the fort. And around the clock, there is like all these threats, not just threats, attacks that are happening. So then what happens is the immune system, in that case, in our example, the army, they no longer have the ability to work on shifts because there is so much attack going on that everybody, all that 20 soldier army, everybody has to be constantly working to make sure that they are able to really guard the fort. And so what happens in this case is that army, every soldier is working 24/7. So in this hypothetical scenario, right, the one that I originally said, they are working in shifts. So each one is working 8-hour shift, whereas now they're working a 24-hour shift. No, not shift, but they're working 24 hours. So what do you think between those two? Obviously the latter, right? When they are working 24/7, they are overworked. And what do you think will happen when somebody is overworked versus where somebody is doing, work a decent hours and they are getting enough rest? When somebody is working overtime, for example, just in your job too, right? If you're working an 8-hour job versus you're working, constantly, what happens is you're overworked. When you're overworked, you tend to make mistakes. And that's exactly is happening here in this case when the immune system is facing a lot of triggers, a lot of inflammatory triggers, different inflammatory triggers, like the ones that I showed you in the previous slide. And over here, I am only, mentioning the important ones here: the diet, the toxins, the stress, lack of sleep. But there are, lots of different triggers. And when that happens, ultimately the immune system gets overworked. That does lead to leaky gut. And then ultimately it leads to inflammation, and it could also result in the development of autoimmune disease. So this is what leaky gut, and I want to spend a little time just talking about what is leaky gut. So that immune system imbalance that happens, right? Basically, the prerequisite for that immune system reactions that take place is a leaky gut. So our intestine, this is basically our digestive system. This is your small intestine, and this is your small intestine, and this is your large intestine. And see how this is coiled like this. And then between this, the coil thing, wrapped around that is your lymph nodules, which are called as Peyer's patches, and that's part of our immune system. So the gut is basically the gut, in the sense the small intestine is the location of 70 to 80% of our immune system. I feel this is a very, very important thing because for me personally, being a science student all my life, and when I was getting into nutrition, I was trying to figure out why diet has a role to play in autoimmune disease. This was like the aha moment for me when I realized that the gut is the location for 80% of your immune system, and it is so basically covering the gut. It's the lining. So then it made like a lot of sense to me that what I eat matters, in terms of my flares. So here, this is a more like a microscopic detail here, but what this shows is that when your gut is structured properly, like normal, then these junctions between the cells, between the intestinal cells, are very tight, like normal tight junction. But when they get leaky and inflamed, as you can see here, there are gaps between the cells. And when there are gaps, and that's why it's called leaky gut, when there is gap between the cells, then what you eat, right? This is what you see. This side is the cavity of your intestine, and the food is in here. And those tiny microscopic particles of food, when they enter the bloodstream, that is when that is what causes all the different immune reactions, including autoimmunity and inflammation. So that, I think, is very important thing to grasp. And I really want you to understand that, because that is going to be the basis of everything else that we talk about in terms of how diet can have an impact on your autoimmune disease. So both diet as well as lifestyle factors, as well as all the other trigger factors that I mentioned earlier, they all play a role in this leaky gut, in the formation of leaky gut. And that's why, just fixing all those factors can help to heal the leaky gut, and that helps to reduce inflammation. So that's a very important concept. And now, as I said, so that when that immune system disbalance, keeps happening, then what happens is it can result in autoimmune disease. And basically what is happening in autoimmune disease is the immune system is attacking body's own tissues. Instead of just attacking, the outside invaders, it begins to attack its own tissues. And again, going back to that example that I gave you about, the immune system being overworked and therefore it's making mistakes. That's what it is. It is, it's just mistakenly attacking body's own tissues. And in general, autoimmune diseases are very hard to diagnose because 45% of patients are, initially labeled as hypochondriacs because they go from doctor to doctor with their set of symptoms, and it's very hard to be diagnosed. They have chronic symptoms of inflammation, pain, and they just, keep seeing different specialists. And medical treatments are also limited. and it affects, just in the US, greater than 50 million Americans are affected. And because of our environment and diet, etc., continuing to be poor, the incidence of this is increasing. Now, this is, what I explained to you, what happens in an autoimmune disease, but I'll just again explain to you. Normal immune response in antigens invade, antigens meaning foreign, cells, the pathogens. When they invade our body, like a virus or a bacteria, then antibodies are formed by our immune system to attack against those invading antigens, and then see how they latch against those antigens, and then they kill them. And then the antibodies they continue to remain in our body, and they have a protective mechanism so that future invasion of those similar pathogens can not take place, right? It helps to prevent that. Now, in autoimmune disease, is immune system forms antibodies to self-antigens. So these are actually the tissues of our own body, and the immune system wrongly, right, mistakenly creates antibodies against those tissues, and then they end up attacking those self antigens, and thereby there is inflammation and tissue damage. Depending upon which tissues of the body the immune system attacks, there is inflammation and damage in those particular tissues. And these are some examples of common autoimmune conditions. Hashimoto's thyroiditis, which is an autoimmune form of hypothyroidism. Interestingly, about 80 to 90% of people with hypothyroidism, who are diagnosed as hypothyroid, they can have Hashimoto's. Hashimoto's is largely undiagnosed. And therefore, a lot of people who have hypothyroidism, and they are just taking thyroid hormones, they don't see the improvement as much, because they are also being attacked. Their thyroid is being constantly attacked. And for those people too, diet can, help. Diet and lifestyle changes can help considerably, because there is an autoimmune component there. There are lots of other diseases like Sjogren's. Celiac disease is the one where, gluten plays a big role in celiac disease. So avoiding gluten is, key in celiac disease. Alopecia, which results in bald patches of hair, psoriasis, rheumatoid arthritis, polymyalgia, even type 1 diabetes, Graves' disease, multiple sclerosis, ulcerative colitis, and Crohn's disease. These are all examples of common autoimmune conditions, but there are lots and lots. There are in general, around averaging about 100 autoimmune diseases that have been diagnosed. So these are just the common ones. The other interesting thing about autoimmune disease that I wanted to share was that 78% of people suffering from autoimmune diseases are women. Now, this is an important statistic because, then women largely, when they have all these symptoms that are chronic, they tend not to, go to the doctor much more than men. They are so that's why I wanted to kind of mention this, that if you are a woman and if you have chronic pain and inflammation, etc., there is a good chance that you have an autoimmune condition. So, definitely go to a doctor and try to push to get all your blood work done. That will help in the diagnosis of autoimmune disease. And finally, again, I want to mention the importance of gut health and immune system. So as I said before, leaky gut is considered a prerequisite for autoimmune disease to develop. And therefore, healing the leaky gut can reduce or overcome symptoms of autoimmune disease. And finally, what are the steps, right? So if you know now that you have an autoimmune condition, or if you do not, maybe not have a diagnosed autoimmune condition, but if you have pain, if you have inflammation, then what are the steps that you can do to heal your gut? First of all, you try and remove all triggers that may be causing your leaky gut. So that includes inflammatory diet, so stop all triggers. And AIP is a great diet for that, because it's an elimination diet that eliminates all potential triggers. Then secondly, also try to limit, or because it's really hard to remove all toxins, but try to limit your exposure to environmental toxins. For example, that you may be consuming through your water. Tap water has a lot of toxins in it, so try to drink only filtered water. Even your air is pretty contaminated around you, so try to limit or avoid exposure to that. Check your home, get an air purifier, etc. Then the second step is to restore and detox. Now, our body itself has capabilities to detox. So we have a liver, right? Our organ liver is really equipped to detox. But what happens is, now that we are so overloaded with toxins from the environment, and over the years, we keep accumulating so many toxins that our liver unfortunately gets overloaded. So, however, again, with giving it proper nutrition, giving your body proper nutrition, giving it adequate supplements, etc., you can help to restore the proper digestion, as well as help your liver to detox. And then you continue to heal your body by giving it probiotic foods, by thereby improving your gut health, and that helps to heal your leaky gut. So nutrient dense diet is very key, and that again, your AIP can give you a nutrient dense diet. And finally, lifestyle factors, they also play. Remember the first slide that I showed you with all the factors that give rise to your immune system imbalance? Lifestyle factors like stress, sleep, and exercise are also critical there. So we have to pay attention to all that in terms of reducing stress, making sure you have enough sleep, and making sure you have the right amount of exercise, not less, not more. And those are some of the key to healing your gut. So that is what we have. And so hope that that was useful for you. And let's again connect for my next episode, where I will talk more about the AIP diet, the science behind it, and why that is helpful to heal from autoimmune disease. All right, so please drop me comments, telling me what kind of topics you would like me to do for future videos, and even relative to cooking or relative to nutrition, please let me know. All right, bye for now.